The inability to concentrate or focus reflects a decline in cognitive function. This is Dr. Lam, founder of drlam.com, and we're going to talk about why this happens to a normal human being. Now, remember that the brain functions normally with a tremendous amount of blood flow. If the blood flow is compromised over a long period of time, but is not compromised to the degree that you get a stroke, then the body's cells, especially the brain, can be crying out for oxygen. When the oxygen level is deprived, then the foggy thinking and memory and cognitive impairment can arise. Think of this carefully. A body that has the brain soaked in oxygen, so to say, is going to have a very sharp mind. On the other hand, if a body is being exposed to an environment where the blood that carries oxygen to the brain is compromised, then oftentimes the thinking can be impaired. Imagine going to a room full of smoke. In addition to the lungs taking a beating, many will feel that they cannot think. They have to go outside of the room to get some fresh air. Well, what does that do? That is really telling the body and telling the brain to clear out of the toxic metabolite of the smoke and replace it with oxygen-rich blood that can carry away the toxic metabolites and replace it with red blood cells that's rich in oxygen. Now, people with adrenal fatigue faces the same problem because in advanced stages, as the body slows down, the blood circulation to the brain is compromised, but not enough to the degree to cause a stroke, but enough over a long period of time on a subclinical basis to cause foggy thinking, mental impairment, as well as cognitive decline. These are all very common. Usually tests are totally negative and the person is given a clean bill of health to go home. But they would find that if they take certain food or exposed to certain chemicals, especially like petroleum byproducts, that these things would come on. So exposed to, for example, gasoline or petroleum byproducts, or even hair shampoos, or walking into a hair salon may be problematic. Paint is also a problematic trigger of these events. So if you do feel that you have mental fogginess, and you have a normal brain and your doctor have already checked you out and nothing is wrong with you, and if your clinical picture matches one with adrenal fatigue where you're under a lot of stress over a period of time and you feel that your body is not handling it well, then do think of adrenal fatigue as a possible cause. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.